Hey guys, so we are ready to start today's live session on the common misconceptions about psychology and actually what psychology is about. So let us add the guest of the day and we are ready to go. Yes. Hi, ma'am.
Hi, Yasuda. Good afternoon and good evening, I would
Good
say. Not good
evening.
afternoon. Yeah, good to see you.
Good to see you too, ma'am. So, how's the day been and work?
Always work, yeah, teaching, um, looking into how to promote psychology. So I think that's most of my work relates to psychology. So, and I was thinking about our discussion today about how to tackle misconceptions and how to promote positive psychology especially among Sri Lankan people and among the youth, right? So I think when we
Exactly.
discussed about having this discussion, we were thinking about how to promote positive psychology for the future. So I was pretty much excited about having the discussion today.
Same here, ma'am. So, let me give a small introduction of what we are going to be talking today. So, as you all know, as we have been telling you throughout, we've been planning to talk about what psychology is, and we'll be discussing about the common misconceptions what people have about psychology. So, hopefully, we are going to take an attempt to discard these kinds of misconceptions people would have. So
Yeah.
I welcome our guest for the day, Miss Dinishika Vitanage. So as you all know, you're familiar with ma'am. So I don't think a special introduction is needed. So let's start with the session. So let's start with the introduction. Like, what is psychology, ma'am?
Yes, and thank you for having me again, Yasoda. So we've been planning to do a series of sessions, right? So we thought we'd start from here because we've been talking about other areas in psychology, but we haven't addressed the most important, pressing issue of how psychology is misunderstood in society in general, even among people who are, let's say, who know about the subject, but they would not have any interest to go in depth and study about it, promote it, help others probably because of certain taboo that is created around psychology and mental health in Sri Lanka and mental disorders. So psychology incorporates all that, right? So our title for the discussion was psychology is us, so which is true because psychology is your overall well-being. When I talk about overall well-being, I address your physiology, your physical well-being, your psychological well-being, and your spiritual well-being. Psychology talks about your spiritual beliefs as well. So that's what we study in parapsychology. So when you take psychology as an academic subject, it evolves from other social sciences like philosophy, like physiology. So when you go into the history of psychology, how psychology uh, came as a separate subject to academia, psychology separates itself from philosophy during the 19th century. Now, when you go back to Greek Roman civilization, where all these social sciences and humanities stemmed from, psychology was known as psychologia, where the word psychologia was consisted of psyche and logia. So psyche is the mind, logia was considered as the air we breathe, the soul. So it's uh, for example, that psychology is sort of connected to the mind and body, right? But when psychology started to transform or started to separate itself from philosophy, psychologia became psychology with the introduction to experimental psychology initiated by Wilhelm Wundt, the German psychologist who we consider as the father of modern psychology, right? So if we start talking about history, I can uh, tell you entire night about the history of
We could have
psychology,
a
how it
separate session on it.
uh, yeah, because it's a lot of facts and information. So basically, this is an overview about how psychology came to be as a separate subject, but we still rely on certain philosophical ideas about how the mind works. Now, I mentioned Wilhelm Wundt. With his laboratory he established in Leipzig in Germany, he initiated the foundation for to do experiments in psychology, right? So this is why psychology is considered as a scientific subject. Now, this is where the misconception that we need to address. A lot of people think psychology does not have a research foundation or experimental foundation, that we cannot study the human being in a laboratory. We cannot study the brain in a laboratory. No, we can do, right? We can. We can study the behavior in a social setting, but we can study the function of the brain in a laboratory. So this is where we talk about brain methodologies as CT scanning, MRI scanning, fMRI scanning, right? So that gives us data, statistics on how our brain works, right? So when you go about brain, you know that brain has different locations where it uh, stores the memory, our critical thinking, cognitive abilities, our higher mental faculties like intellectualism, and how our emotions are controlled and managed. So these areas can be studied in a lab. So that's what Wilhelm Wundt wanted to establish. So basically, he went on to studying people's feelings. But for that, he could not come up with an experiment because he called it the introspectionism. Introspection means you look into your own feelings and thoughts and kind of interpret how do you feel? How do you feel about an incident? How do you feel about a person? So for that, he could not establish the scientific experimentation. But initiating the laboratory itself was a bigger win, a victory for psychology to come to the part where people have thought psychology is about philosophy. Anyone can say anything about the human mind. We can interpret the human mind. We can disregard mental illness. But that misconception was academically attacked, challenged by Wilhelm Wundt. And after his students, especially Stanley Hall, take psychology to United States of America from Germany, and in the US, the psychology started to flourish in 1843 at Johns Hopkins University. So likewise, there's a line of history where psychology became as an established scientific study of human mind and behavior. Now we do not say psychology is about, studying about mentally ill people, studying about whether you are going crazy. We do not give that definition. The definition of psychology is scientifically studying about the human mind and behavior, because human behavior can be observed. Human behavior can be observed and researched and be observed in different fields. We may not be able to take the behavior into a laboratory all the time, but certain areas of branches of psychology can study the human behavior in a lab. Now, for an example, Albert Bandura came up with the social learning theory, where children would learn from adults. So for that, he did the Bobo doll experiment, where he got a doll in a lab and started reacting to the doll, started treating the doll in a certain way, so the children could see. So once the doll is given to the child was imitating what the adult was doing with the doll, hitting the doll, pushing the doll, likewise. So therefore, the human behavior can be taken into a laboratory and studied. So the misconception about psychology is not scientific, it doesn't have a history, it's part of philosophy, is wrong. These are the things that we need to get rid of people's mind. So that's just a start.
Of course, so it is the science of studying the mind, not reading people's mind.
Exactly. You can't change person's mind by talking, because and psychologists or clinicians are not miracle workers. You work with people, so psychologists and clinicians, psychiatrists have to be trained in their fields. So that says a lot about who can be in the field of psychology. So let's say I don't have any background, a theoretical background or a training experience, a learning experience in counseling. I can't go and counsel people and say, oh, I have read books about psychology, I think I can approach your problem. That won't help the person. So this is why
Exactly.
we establish counselors and psychiatrists under ethical regulations and under academics, so that they can give a proper established service to people who are in need.
Of course. So, yes, we will be coming to that. But before that, ma'am, I wanted to ask you to give our audience an idea about the subfields. Now, as you said earlier, many people think that psychology is about treating mental illness only, or it's dealing with
Yeah,
mentally disabled or mentally
yeah,
disoriented people. So, it's not as such. We know in, like, as we have learned, we apply
yeah,
it in various fields like education, organization, and we even discussed about how it's applied in organization as well. So,
yes.
can we just give a brief about like in what arenas psychology plays a part?
Yeah, that's a very good question, because I think even with a lot of the students that we meet, they only think psychology talks about counseling. Psychology is all about mental health in just the counseling field or psychiatry. So beyond that, if you study psychology, you're lost. You're lost in anywhere because you can't apply psychology. So this is where we talk about applied psychological theories or applied psychology. We apply the knowledge of psychology to another field. It can be marketing, it can be management, it can be medicine, it can be engineering. I can name many academic disciplines that we can apply psychology. So like you said, the arena or the space or the area of psychology is not limited to counseling or psychiatry. So we have, uh, as branches of psychology, under the main umbrella of psychology, we are more focused on physiological psychology. That is to study how the brain works. And the question about where the mind is located, is it in the brain or is it somewhere in the body? Now, that question goes back to philosophy again, because a lot of philosophers earlier times thought mind and body work separately. So mind is something somewhere in the body, completely separated from physiology. So the nervous system, your body, doesn't have anything to do with your brain. So philosophers like Rene Descartes, we call that Descartesian theory or Cartesian theory or dualistic theory of mind and body. He believes that mind and body separately working uh, for the human being. But later, when the experimental psychology was established, we came to know mind and body work together. The nervous system is connected to the brain via the brain stem. So if the brain dies, you will die. If the brain gets damaged, it will affect the body. So physiological psychology is one of the key sub areas. We understand how the brain works, and then from the brain, how the mind works, and how the mind kind of manage, control our thoughts, our feelings, our emotions. Now, especially when you take hippocampus in the brain, hippocampus is more prominent for learning and memory. So if you damage hippocampus, you're probably damaging the area that you can understand and learn a new subject, learn new information. Your memory will be damaged, right? So likewise, we not only study about how the thoughts are generated, but the thoughts are generated because the brain is working along with the mind, right? So mind and body has a very strong connection because our five senses, we grab information from the outside and the brain has to process it. Just like a computer, like I always say, mind is your software and the hardware is your brain. So the brain has to process information. So the psychological knowledge of how these two things work together is studied under psychology. And then we go into talk about our development. How do you develop from birth to death? What is death? What is life? These are philosophical questions, but how do you study them scientifically? Because psychology has an approach about studying certain illnesses that arise on different age groups, mental illnesses that arise in different age groups, and how do we look after ourselves, right? And how a pregnant mother would look after her, not only physiologically but psychologically. How to talk about, address about children's issues, right? And then we talk about the cognitive, the higher mental faculties. What is intellectualism you have? What do you mean by you are being intellectual and smart? Is it something to go with education or is it separated? Now, there are so many areas that we use to discuss using the knowledge of psychology, how the mind and body works, and we use the research. So if you do not do research in the field of psychology, there's no development. And also, we can branch out psychology into mental disorders, abnormal behavior, normal behaviors, counseling, psychotherapy, right? And someone who studies in these areas can go into industries, can go into schools, become a child psychologist, become a counselor in a school, in a company. It can be an IT company, information technology, but psychology may need to sort of assess, evaluate the employees, how an employee's satisfaction is applied to efficiency of the company. So when you look into these areas, it is very clear that without psychology, you can't do anything. This is why we, I think, agreed on psychology is us. It's our overall well-being, how we arrange our thoughts, our feelings, and how we communicate that with other people, right? So if you are not, if you, let's say, if you do not have a proper understanding of how your mind works, how your body works, you may have, of course, misconceptions about a subject that you do not know about, right? Just because you do not know about the subject doesn't give you the right to badmouth it. I feel like in the Sri Lankan society, psychology is one of the subjects that has been badmouthed, right? And those who study are being looked down upon. I get students, most of the times, they come to me and tell me, many people, when they come to know they study psychology, they would question them as to why couldn't you find a different subject? Marketing is better because it's generating money. Engineering is better. I'm not saying other subjects are bad. I'm not comparing them to psychology. But I think they may say this because they do not have an idea about what psychology is. I think the blame should go to certain institutions, our education system in the country, how people are getting information about psychology, right? And people who are in the field of psychology are not actively promoting what psychology is. So there is a higher chance of people are being misinformed about what really psychology stands for. So for now, it stands for counseling. It stands for people who have gone crazy, the mentally ill. Like in Sri Lanka, I have heard people saying, "Mano vidyav hadaranne pisso," right? So
True,
that is
yeah.
such a derogatory way to place psychology. So there's no such thing as people who are going through a certain mental illness or a problem should study psychology, or they are the people who get attracted to psychology as a subject. There's no such thing. Anyone can study psychology
True.
and can be
And
applied into your life.
yes, and funnily, when we have something, so it doesn't mean that just because we study psychology, we don't have issues, right? But
Yes,
there are people who
exactly.
comment, like, suppose we, like, obviously, there are times where we feel down or angry or something like that, but they comment on you saying that you're going crazy because you're studying psychology. That
Exactly.
drives you crazy.
Yes, I mean, I think uh, they use it as a little like a weapon to attack you. You have no control of yourself because you are crazy. That's why you are studying psychology. So they somehow try to connect it to psychology because you are studying psychology. You are a scholar, you are a student, you're part of the field. So therefore, you are a person who goes crazy. So I have no idea how this got established, but when you go into seeing how the state or the government or other institutions have supported psychology in the Sri Lankan society, it's very less. So there is no established institution or organization that can promote positive psychology among people. Now, I think I have mentioned this to you as well. When you talk about mental health policy in Sri Lanka, it hasn't been updated for
Yeah.
2021. We have a document that starts from 2015, and it hasn't been updated and has not been reached provincial and different districts and provinces in Sri Lanka, promoting either mental health or counseling or any other form of psychological support for people. So in a phase like that, the misconceptions that comes from society is uh, large. So it's kind of, I'm not saying it's justifiable, it's kind of a problematic way that there are no information system for people to get true, authentic information about what counseling is, how am I going to find a counselor. Now, in other countries, you have yellow pages. We don't have yellow page system. Even people are reluctant to call up certain hospitals to find about a psychologist because of that societal taboo that has been created. Only a crazy person would go and talk to a counselor or a psychologist. So I am better, my family members are better. So to what extent do you know that your family members are psychologically uh, fit, right?
Yeah.
You may see the person physically fit. I'm not trying to put people down, but this is a realistic question that we can ask. To what extent do you know about a person's mind? You can't read a person's mind, not even a psychologist. The symptoms can come from physiology, so physically, how a person behaves, how a person reacts to a situation, right? So to study that, we have trained psychotherapists and counselors. But to what extent these support systems have reached people inside the society? That's the problem we need to address. So if not, people are being misinformed over and over about psychology. Now, honestly speaking, psychology is one of the stigmatized subjects in Sri Lanka and highly gender oriented subject because a lot of people think only females can study psychology. It's a female subject, right?
Yes.
So that's one misconception that we need to address. Now, scientifically, the research has pointed out that uh, compared to men, a lot of women would be prone to get depressed. That's a scientific foundation, but that doesn't mean men would not go through depression. Men can also be exposed to depression, but the rate is higher when it comes to women. And when it comes to the structure of the brain of the woman is kind of different from the man. So it is been pointed out scientifically, the hippocampus would operate differently from man to a woman. So as women, we are more empathetic, we are more emotional. That comes with the nature of the female physiology. But that does not mean, that's not a justification that psychology has become a female oriented subject, because a lot of females would go to the field to study it as a subject, and men are not supposed to study psychology because they are not emotional enough.
Mm.
So the emotions are created by the society to say men don't cry, boys don't cry, men don't show their emotions. They are not supposed to be showing emotion because that is a masculine quality. I
Mm.
think the society put a lot of pressure on both genders, especially on boys, men, that psychology should not be studied because you are a man. If you are a man, you should study science, biology, mathematics, engineering, because these are the masculine subjects. So that is missing information that give to the young people in a country. So the more we spread that information, the more the young people tend to believe, yes, then psychology must be a female subject. So I don't have to, even if you have the interest, because of the stigma it creates, you may not be able to go into the field and study. And not in Sri Lanka, but they may even leave the country. So one problem here is that we have lost a lot of educated, smart, intellectual people in the field of psychology who can contribute to the society. When they realize that they are being stigmatized, being psychologists or working on research in the society, people have left the country where they can get more opportunities. So we should blame the system for that. We should blame the policymakers for that, not creating a very confident environment for them to operate. So most of our Sri Lankan psychologists and psychiatrists are serving other societies in different countries. So we have very few located here and working for the betterment of the field, and that's really sad.
Yeah, very, very sad. And probably the systems are very busy with all other things except what's important. I hope
Yes,
no government related person watches this.
yes, but that is true though. Like I think even the participants here would agree with us. We are constantly being distracted by certain things that's happening in the country, but not about the very important things that people should relate to and get help from. So we
True.
have become a country, I don't know what, but we get so many crazy things
All the
happening
sensational
every
things
month.
go flying around. Gossips are very famous. News is not
Yes.
given importance. So
And the use of
it's
social
sad.
media and the use of social media to spread misinformation has become a problem now. And it can be psychologically affecting someone. We do not think about it, but a
True.
lot of people negatively affected by misinformation that is given through social media. And the misuse of word like lunacy, or in Sinhala we call it pissu or pisto, right? So that gives psychology a very misguided reputation in the academia.
Probably it's because like the word psycho is used a lot in Sri Lanka. So like when someone behaves in a way,
Exactly.
they are like, that guy is psycho. So maybe they connect the word psychology and they just take out only psycho. So they don't
Exactly.
understand or they don't know that the word means psyche is mind. They think that it
Exactly.
means
Exactly.
crazy.
Exactly. It's a good point, Yasoda, that you pointed out. A lot of people do not know the word psycho stands for psyche. It is the mind or psyche, we would say. So they come across the word psychology, so they think, okay, someone is going a little bit crazy. We can call the person a retard or a psycho. Now, this word is specifically defined by American Psychological and Psychiatric Association, and they have come up with the DSM-5, the Diagnostic Statistical Manual of Mental Disorders and Personality, the fifth revision they did. So in that, they specifically point out who is a person having an abnormal behavior, a mental disorder, and not having normal behavior traits. Now, there's a difference between normality and abnormality. When it comes to psychological disorders, a normal person may have different way of reacting to a situation. The abnormality comes when a person who's under stress or under depression or under a brain damage may interpret the situation differently. That does not mean that person is going crazy. That means the person's brain chemicals, the functionality of the brain has been damaged. So therefore, the person may not rationally interpret a situation. So that's the difference between a normal person and abnormal person. But when it comes to people, people take it in such a face value of it and use the word psycho to demean someone's behavior or in a derogatory term. I think this information needs to be given to the society. How do we treat, how do we approach a person with a mental disorder? And how do we sort of support the person to kind of discard the stigma around that particular mental disorder? Now, the most common mental disorders are depression and schizophrenia, where you become very depressed with, it can be a personal issue, it can be issue that you have at your workplace, your school, with your friends. Something can be there for you to feel depressed, right? And then schizophrenia becoming delusional. But the information about these mental disorders are not properly given to people to understand the symptoms. I think because of that reason, people are more prone to sort of assume that every person who goes under a certain mental disorder, may it be severe or mild, is a crazy person. You do not drive yourself crazy. These are preventable and curable and managed. Just because a person goes through a severe depression or stress does not mean that person go crazy. Now, this word lunacy has a history. I think centuries back, we had something called asylum. They are very different from mental health institutions. Now we do not use the word asylum. Asylum had different characteristics of people who got mentally ill, got admitted to the asylum, and they got tortured. The people who were running the asylum did not have proper training, did not have proper knowledge about to do testing. So therefore, the patients got tortured and some patients never left the asylum. But now we do not use the asylum and certain therapeutic methodologies to approach mentally ill. So we have mental health institutions now, or mental health hospitals. Now, I think the word lunacy comes with the asylum, that people have gone crazy. And it has been said that even normal people with a little bit of different reactions to situations have been admitted to these asylums and got tortured, and they have died inside the asylum. So there's no rights. The person cannot defend for himself or herself. And a lot of females who actually worked for human rights activism, women's rights activism, have been admitted to these asylums thinking they are crazy. So they are not very feminine enough, not female-ish enough, not feminine enough. So therefore, they are being abnormal, right? So that idea has now gone out from history, and now we have come to a bit of a holistic way of looking at mentally ill patients. But the problem here is people still intertwine this asylum idea to mentally ill patients and think everyone who comes under a certain mental disorder are going crazy. Even if you say, I am a little bit of stressed out, people tend to think, oh, you might be going crazy. I think this term going crazy needs to be put in context, not in its face value. So at least our young people have to understand the vocabulary of psychology and certain words that they can use, they should use, and they should not use.
Further, there is also this idea that people who are affected by mental disorders or those who are mentally impacted are harmful. So that's the other reason why the people think this word crazy is going around so
Yeah,
crazy, because they mostly think that they are harmful. But people fail to realize that people of this nature need help and they are not
exactly.
violent all the time.
Exactly. Now, the nature of mental health illness is a person can be harmful when the condition comes very severe. But if we detect the difference of behavior and the symptoms on its onset time, onset period, most of these mental disorders are preventable and managed and controlled. You may not go into curing the person right away, but we have to diagnose the person, put the person on medication and therapy, and assess the person. That is how we go about treating a mentally ill patient. But the problem in the society is most people do not seek help or take the individual for proper professional mental health care. But when the condition gets severe, either these people are driven by the thoughts of committing suicide or harming someone else because of the condition, not because of their rationally thinking, okay, I'm going to kill someone because I think that's the best thing to do. But these people are run by the condition they have. They may not logically think, because once you get a mental health condition, your brain chemicals starts to change, your hormones start to change. So your hippocampus may work differently, your intellectual properties may work differently. You may not think as a normal person taking rational decisions. So the person is entirely driven by that condition. That is where when a person can become harmful. Just because you are stressed out or going through depression doesn't mean that the person might be there to harm you, kill you, and be dangerous. So the notion about these mentally ill patients are dangerous have to be taken off from people's minds. So the best thing you can do is, if you know a person whose behavior is different, whose mood will become different, take that person to a counselor or get help, professional help. You please don't go into this doing toil, right? Doing these rituals. I am not putting them down, but we need to differentiate between the supernatural powers of healing a person for mental illness and the standard ways of addressing a patient with mental illness, right? Now, we have a case where this little Muslim girl was beaten to death because of a ritual to get the demons off out of her spirit, her soul. That didn't work, right? So she could have gone to a child counselor or a psychologist. So the problem here is, to what extent her parents were informed about her condition. Did they assume that she had a mental health condition? We do not know, because we got limited information about how it happened. But this cannot be happening to people because you think getting mental health service or counseling or psychotherapy is a taboo, right? Because at the end of the day, you might lose yourself or you might lose someone you love forever. So if you want to stop that happening, you have to research into this, find information where you can get, and as soon as possible get help for the person. I think no matter how we emphasize on this, people still are kind of shackled by these cultural ideologies of, well, mental health is not something we want to talk about openly. I think that's where we have gone wrong. So compared to other countries, when it comes to mental health approaches, we are far behind. We are so behind because the society is not educated. Even people who want to study psychology comes up with this misconception and they want to confirm them in the program, during the program. When they do not confirm that during the program, they get frustrated because they have something else in their mind. But now we study psychology as a scientific subject. We talk about experimentation, we talk about therapeutic methodologies, measures that we do, psychological testing, psychometric testing to understand the state of your mind, how intellectual you are, your chronological age, your mental age. We talk about all of these things. So only way you can find the mind, how the mind and brain works, is to read research and read into what real psychology does. So do not go on the surface level just because people say psychology is a subject where nothing happens and psychology is for crazy people. Do not agree to that. Do not promote, spread misinformation about something that you actually do not know about. So find about it, talk about it.
Yes. So the next thing I wanted to discuss about was, ma'am, about the pathways that we need to take. Now, at the beginning also, you just gave a brief hint about it, where people just say, I have read psychological books on psychology, so I can help you with this issue and things like that. And like,
Yeah.
simply people say, I have completed this diploma in counseling, so I'm a counselor. So like, what is
Yeah.
the pathway, man? And they think that just completing your BSc is enough for you to become a therapist. Again, so much of confusions about the pathway we need to take to get into different professions. So again, there are
Yes.
confusions about like who is a counselor, a therapist, who is a psychiatrist. So
Yeah.
much confusion
Yes.
among the people, and they really don't know what they are supposed
Yeah.
to do what. So can we
Yeah.
just
Exactly. Yeah.
give an idea?
So, yeah, if I look into the Sri Lankan history, I thought of talking about the Sri Lankan history because all our participants here are Sri Lankans, right? So, in 1943, we established a psychiatric institution for mental health in 1943. So, after the independence and after what happened in the country, the British government wanted to establish psychiatric services inside the country. So therefore, since we did not have an academic established institution to train our people for psychiatry or counseling, the Brits had to take our doctors into England and train them and bring back to Sri Lanka so they can establish a certain mental health institution to provide for Sri Lankan people. And during 1970s were the best time for psychology in Sri Lanka because there were initially 13 clinical psychologists in the country. The number was very less. Why? Because people were not interested in the field. They didn't know how to go about it. So there were few people. So that actually shows psychology was a very new subject to Sri Lankan society. And people did not want to talk about how your mind works. People are very secretive about their problems, about the mental illnesses, and probably they didn't know that they were going through stress, they were going through depression, no idea about what schizophrenia, delusions, mania are, right? Now, all this information we have gotten from either US or UK. And our psychologists and psychiatrists have to train outside of the country. So when they come back, they started to sort of do research inside the Sri Lankan society and spread the knowledge. But the problem here is that many of our psychologists and psychiatrists think that our policymakers, our governments, the system are not helping them enough. They don't have the resources to conduct research. So therefore, a lot of people who are in the field have left the country for better opportunities. But however, with the people we have counselors and psychologists operating in main areas like Kandy, Colombo, but in provincial and district wise, we have a problem whether we have allocated psychological help for people who are not living in the urban areas, in the suburbs. That's one of the questions we have. Do people who are away from town areas in the urban cities and towns know about what mental health is? Do they have a system to approach, talk about depression, postpartum depression after a mother gives birth, right? So, do they address these issues provincially and district wise? Now, when we talk about a counselor is a person who is trained academically, let's say, has a BSc or a master's degree, not a PhD, but a well established training in the field being a counselor. So the counselor should have more than 1 year of a training in the field and have license to operate as a counselor. So a person who does not have counseling license is not regarded as a counselor legally, because the counselor has to be bound by the ethics given by a psychiatric association or a counseling association operating in that country. That's the benefit for the counselor himself or herself and the client, to safeguard both parties. But a psychiatrist can be a person who has a medical degree and studied psychology into clinical psychology, studying about mental health disorders, mental health, and approach a person giving a therapeutic and medication. We say drugs, giving medicine. So a counselor cannot do that because counselor does not have a training in the medical background, right? And a psychologist is a person who is behind the scene. A psychologist is someone who does a lot of research about the problems regarding a person's personality, a behavior, a society. So they do research. So a psychiatrist and a clinician, probably a clinical psychologist, may rely on this research to study. So what's the biggest problem do we have? How many people go through depression annually or in 6 months? So they look into the different patterns of behavior of people. So basically a counselor and a psychiatrist are more active in the field compared to psychologists, because psychologists are more into the research studies. So sometimes people get confused between a psychiatrist and a counselor. Now, for certain mental health disorders, you do not have to go to a psychiatrist. You may not need medication, but you can go to a counselor and talk to the counselor. So if the counselor thinks the level of your mental condition is severe, you need medication and therapy, then he or she can refer you to a clinical psychologist or a psychiatrist. But this information is not properly, again, distributed to people. And because we say we have a hotline, but if you talk to a lot of hotlines in Sri Lanka, they don't operate. Either the number is wrong or no one is answering the phone, right? So that's the realistic, I don't know, the things happening in Sri Lanka. So these hotlines have to be active for people to get help. Now, even I'm very sorry to say this, but if you call 119, it takes up to 1 hour for them to reach an emergency situation. Incident recently, something like that happened, and we were waiting until 119 comes, and it took more than an hour for them to reach the situation. So when something happens like that, the trust people have for the system declines, and it can happen to people who are pressured by mental health, right? We do not have resources for them to seek help quickly, right? A person who's going through a panic attack or anxiety attack, if the person does not have anyone to look after, we need to have a systematic way to get help. Send a paramedic, send someone, a counselor, to the person's house to see whether this person is doing good before the person does something to herself, himself, or to someone else. Do we have a system like that? So that is questionable, right? Unfortunately, that is why I think the attention that we have given to the well-being of a society's mental health is nowhere close to other countries when it comes to Sri Lanka. We are far behind. We are far behind with the knowledge of how we can get help and in general psychology. Because of either we are lazy to get proper information, or we just agree with the mass or the majority idea that psychology should not be studied because of there are so many misconceptions. So if someone wants to study psychology, please register yourself with an academic institution and study the theoretical aspects of psychology, how to put these theories into practice. That is what we do as counselors, psychiatrists, clinical psychologists, researchers. We put those theory into practice to different social contexts. So the theories that we learn, we apply them into when you are confronted with different situations in your life. That is why psychology is us, because we talk about our own emotions and how we properly react to them. If you do not have a better understanding of a theoretical understanding of how do you define depression, how do you define stress, how do you define a different other psychological disorder, you will probably put them all in one basket and have a lot of misinformation about it. So a person who needs to understand psychology needs to have an established academic background to go forward. So it is needed. Let's say someone does not want to study psychology in an institution, then the system, the government has to have information center where people can obtain information. Maybe a web page, established web page with proper authentic information. These are the hotlines where people can find counselors, child psychologists. So these are the doctors, counselors you can approach. I don't think any document like that is being circulated among the people in the society. So therefore, they have no idea where to go. So we can't blame the people. We can't blame the society. We have to blame the policymakers and those who are involved in the field for not promoting positive psychology among people.
And also another problem in our society is, ma'am, the way people use the internet or information sources. Like, even though there are several ways of obtaining things where people have information at their fingertips, still they're very ignorant about things. Like, unless someone goes and tells them, this is what you can do, this is how you can gather information, they have their mobile phone, they always dig into it, but it's about finding what happens in the neighbor's house or what happens in what celebrity's life. Other than that, our people have no knowledge of what this internet is to be used for, and even social media. It's just about all these kind of things.
I think in a systematic way, usually even in psychology, we point out that the mental, how the mind works can change according to what changes in the society. Now, this is what we study in social psychology. The behavior of people change over time. How we react to certain social change that happens in the society. It can be something political, it can be something economical, it can be something that affects a lot of people in the society. So the way we react to a certain social situation change according to your state of mood, according to how your brain interprets information, and according to the knowledge you have about something, right? So with the change, my problem is, have we done something about mental health well-being in Sri Lanka? Have we used social media to be up to date about giving people information about what mental health is? How do you protect yourself mentally, right? We talk about applying moisturizer, getting fair, you have to get your skin fair because then only you can find a partner, then only you can get married, then only you can get a job. Sometimes I feel like, where did we go wrong, Yasoda? In Sri Lanka with people, where did we go wrong? Because the people do not have a single idea about confidence, how to build motivation, how to build self-efficacy, self-esteem. Your self is worth. You can boost your mind, you can boost your memory, you can damn well use your social media to not only look after yourself but to spread the word to look after someone else. Where did we go wrong? How did we go wrong? How did we become so ignorant about psychology, something that we keep here and within us? Psychology is us, it's within us. We live with it every damn single minute. But the use of it has not been taken by a lot of people. So my problem is, as a Sri Lankan society, why are we so far behind with other countries when it comes to understanding mental health? And why are we reluctant to openly talk about it? It's because the reaction coming from the society is harsh on people, especially women, and especially on children, right? So there is a cultural barrier, a strong cultural shackle that pulling us back all the time when we approach mental well-being of people in Sri Lanka. It is such a sad situation. It's pathetic when that happens as a vicious cycle. So even if we do research, now I love to do research, but sometimes I feel like, will that be helpful? Because my research may not be read by some a person, but I still would contribute. But how would people get benefited? So we need to read research. We need to do the work that is needed to educate people. Those who are not academically probably learning psychology as a subject. So once you have that idea, you probably on your own would discard all the misconceptions that is surrounded in psychology, by psychology, the misconceptions.
Yes. So, yeah, so I have asked all questions that I had planned for. And as usual, it was a very, very interesting conversation. And I hope people who watched took down notes, because that was a load of information that we had today. And everything was really useful. So I hope it goes to some use, at least in a minute level, to the ones who have watched or listened to us, because it's not just about promoting the subject or the field or some form of a course
Exactly.
here. It's about how important it is for us to know how much mental health is important, and avoid these
Exactly.
wrong information you get about not just psychology but anything.
Exactly, because I think as an independent scholar, you have been promoting psychology, the information about psychology, and I've become part of it, which I'm so happy that you have invited me for a series of discussions. So that is where the initiative should take place. Getting the information out to the society. You don't have to be a psychologist to think about psychology. Think about your well-being and think about other people, but use the resources, information you have to promote, to discard derogatory terms being used on people, demeaning people, respecting people with empathy, giving attention to people's emotions and respecting that. Because as much as you want to protect yourself, guard yourself, other people also want that respect. So that is why we promote empathy in psychology. So the best way you can do is use your social media to update yourself about psychology and encourage someone to do the same.
And not just have it as a trend for a few
Yeah.
months or something, just when you
Yes,
hear, especially when you hear that a
exactly.
celebrity committed suicide or did something,
Yes.
then it's all over the place. This
It's a
person
big
was
deal.
depressed, no one should
Yeah,
be depressed, we should not let anyone kill themselves, and then it's gone
exactly.
until someone else does something to themselves,
I think
especially a
you're right.
famous person.
Yeah, I think the entire society gets all worked up when a celebrity, something happens to a celebrity because it's a celebrity. So you think it's a loss. But think about people, the unknown reports we have, ton of people, number of people committing suicide, our youth, young people dying because of mental disorders, and maybe families are locking them up because of the taboo. So think about people who are deprived of reaching services, mental health services, going to a counselor or psychotherapist. I think we need to fight for these people who are unheard, not the people who have the resources because they already have the resources, but the people who are unheard about their psychological issues should be paid attention. So from district level to provincial levels, the mental health should be spread through the country, not just focus on Kandy, Colombo, Kurunagala, Gampaha, the main cities, but to other areas where people have problems. People have their own issues to deal with. They need support. So what
Definitely.
can you do through psychology? So if you can do something, you must do it.
Definitely. So thank you so much for joining, ma'am. It was again, as always, very interesting and I had a very good time. So I hope, just as I mentioned, some use goes into the society from this, and I hope to see you again with another interesting topic. And thank you so much for joining me, ma'am.
Thank you so much for having me, Yasoda, and I wish you all the best for everything you do promoting psychology. And I'm always happy to help you. And I thank the participants who had patiently probably listening, right, to our conversation and do something to promote positive psychology among friends, the society, and to attack the stigma about mental health. Because mental health is not a stigma, it's not a taboo. It's normal for people to uh, get stressed, depressed, but you can always seek help, professional help.
It's always about us.
Exactly. It's psychology is always about us.
So, okay, ma'am. Thank you so
Okay.
much and have a good night. See you again.
You too.
Bye.
Have a good night. Have a good night, everyone. Bye bye.
And thanks everyone for joining. Have a good night. Bye bye.